Today we are gonna discuss about IV anesthetics, that is intravenous anesthetics. So firstly we are gonna study about IV inducing agents, faster inducing and slower inducing agent. Let us start. IV inducing agent, there are faster acting agents and slower acting agents. Under faster acting we will get barbiturates and non-barbiturates. Under barbiturates we get thiofenton and methotrexate. Under non-barbiturates we are having propofol, ethomidate and ketamine. I prefer only to know this propofol and ketamine, which are very important. And under opioid you will have fentanyl, remifentanil, halfentanil. These agents are 100 to 1000 times more potent than morphine. Next is benzodiazepine. Under this we are having diazepam, lorazepam, midazolam. This diazepam is used there are two types, IV and per rectal route of administration of this diazepam. This IV is given for seizures, acute seizures, and per rectal is given for febrile seizure. Okay. Then next is lorazepam is given in IV in case of status epilepticus. Midazolam, it is inhalational route for febrile seizures. In other drug we will read about neuroleptic agent in upcoming minutes. So next we are gonna study about major one, like in order wise we are going. Firstly we will study thiofenton and propofol, ketamine and this opioids and benzodiazepine. And also in this opioid only I have added this neuroleptic agent. Okay. Now thiofenton. So there is an order to write this thiofenton, like about thiofenton, that is its importance, onset of action, that is induction time, and duration of action, and its potency and dose, its form, in which form it is available, and its effect, drug of choice. It is majorly asked for 3 marker, or you will have to of course write it for 5 marker without missing it, and also side effects. Okay, we will start. This thiofenton is a most common inducing agent, intravenous inducing agent. So onset of action is very fast. It only takes 15 to 30 seconds to act when administered. Duration of action is short, 5 to 10 minutes only. So it is onset of action is fast. It is due to high solubility, means it is lipid soluble. To enhance its lipid soluble furthermore, we will add sulfur to phenobarbital. This phenobarbital is under barbiturates, which will also be coming under thiofenton. So we are increasing its lipid solubility. So especially dose, how much dose we give? 4 to 5 mg per kg. So beyond 5 mg per kg, if we give, it will lead to toxicity. So we need to maintain this dose. Its form I have told. It will be available in yellow powder. It is reconstituted with distilled water or dextrose. Okay. Effect on CNS is cerebroprotective. Drug of choice for neurosurgery. Read in this order: neurosurgery and any history of epilepsy. Patient with history of epilepsy. And it is also agent of choice in cerebroprotection, as it decreases all the cerebral oxygen consumption, intracranial tension, and also decreases metabolic rate. Okay. So it also decreases BP and increases heart rate. So it is contraindicated in case of shock and heart block patients. So decrease in intraocular pressure. IOP means intraocular pressure. So it can be used in ophthalmic procedures. So always remember to write in order, so that you won't miss any points in middle. Okay. Now this was about thiofenton. Now we are gonna study about ketamine. Firstly, ketamine. This also you need to write it in order. Ketamine is a phencyclidine derivative. So onset of action, this is O actually, onset of action or induction time is 30 to 60 seconds. Duration of action is 15 to 20 minutes. And there will be rapid redistribution after this 15 to 20 minutes. There will be redistribution to adipose tissue. Okay. Dose will be 2 mg per kg. Mechanism of action. So dose in thiofenton was 4 to 5 mg per kg. Here only 2 mg per kg. Mechanism of action, it will block glutamate mediated channels or receptors, that is NMDA receptors. It is having strong analgesic effect but lacks muscle relaxant property, which is majorly needed in balanced anesthesia. Used as dissociative anesthesia. It is only used for maintenance, not for induction, as it do not possess muscle relaxant property. So we are using multiple drugs. We can't only use one drug for inducing to maintain balanced anesthesia. We need to use 3 to 4 drugs within this dose limit to produce balanced anesthesia or total anesthetic effect, intravenous anesthetic effect. Okay. So it does not depress pharyngeal and laryngeal reflexes. This is important. So we could use this ketamine dissociative anesthesia in emergency cases wherever the patient stomach is full. So it doesn't depress pharyngeal and laryngeal reflexes. Okay. It also increases all the pressure like BP, intraocular pressure and intracranial pressure. So we can give this in shock patients. It is not contraindicated in shock, but contraindicated in glaucoma because it increases intraocular pressure, and head injury as it increases intracranial pressure. Know this too. If you want, study this hypertensive also contraindicated and cardiac patient also contraindicated. Side effects, as it is phencyclidine derivative, it is hallucinogenic. So hallucination will be there. Our study means hallucination will be there. With hallucination, we'll get vivid dreams, illusion and excitement. So that was about ketamine. Now we are gonna study about propofol. Propofol is interesting actually. It is white powder. We have to use within 6 hours of time. Beyond 6 hours we can't use it. Oil-based preparation injection will be painful. So we will give IV lignocaine to reduce this pain. And onset of action is 15 seconds. It is also faster. And duration of action is 5 to 10 minutes. Okay. Dose will be 1 to 2 mg per kg. In ketamine it was 2 mg per kg. In thiofenton 4 to 5 mg per kg. In propofol it is dose will be 1 to 2 mg per kg. Okay. Mechanism of action, GABA receptor agonist here. There it was in ketamine, it was blocking NMDA or glutamate mediated receptors or channels. Okay. Here it is GABA receptor agonist. So what are all the drug of choice? Propofol is added with this alfentanil. It is an opioid. It is added with this propofol to give an total intravenous anesthetic effect. Okay, and also for sedation in ICU and daycare surgeries, they are choiced. Propofol is choiced. Side effects will be pancreatitis, hiccups, dyslipidemia, mainly most commonly seen in pediatric patient as they are infused this propofol for 2 to 3 days. That was all about propofol. Now we are going to read about slower acting. With this we have finished faster acting like barbiturates, non-barbiturates. In barbiturates we have studied thiofenton and its important side effects, drug of choice and contraindication of course. In non-barbiturates we have studied 2, that is ketamine and propofol. We have missed etomidate. I felt it is not important. Etomidate is a cardiostable anesthetic and it can be preferred in cardiac patients. Now we are going on with slower acting agents. Slower acting benzodiazepines. So it is it facilitates or increase the duration of opening of chloride channel and it will lead to hyperpolarization of neuron and will lead to CNS depression, which is unsafe property actually. Drugs used here: diazepam, lorazepam, midazolam. I have already told the importance in the starting of the class. So it is not having analgesic effect but possesses muscle relaxing and anticonvulsive property, which are majorly important. So lorazepam is used in hepatic failure patient, and midazolam is used for daycare surgery. If you want, you can study, or else you can leave this point. So these 2 points are important, and the drug name is important. There are many more drugs like this. I have only added 3 which are majorly asked and majorly used as a drug of choice. Now we are at last topic and last slide of this video, that is opioid. Under opioid we will get fentanyl, alfentanil, remifentanil are the opioids which are used in anesthetic, and they are 100 to 1000 times more potent than morphines. I have already told you. If for also I have told in the starting of the class that there is neuroleptic anesthesia. I have added this under opioid because we will add this fentanyl with droperidol, which is anti-neuroleptic agent, and we are adding it also with this carrier gas, that is nitric oxide, to produce the effect or act as a neuroleptic anesthesia. So this was all about IV anesthesia. In upcoming video we will see about antipsychotics, opioids, and anti-epileptics, as well as inhalational anesthesia, local anesthesia, as well as muscle relaxant, and we'll finish this CNS part. Now I have made these notes, so I'll be giving the link in the description box, so you can download it by clicking that link, which is present in Telegram channel. If you find it helpful, please do subscribe.